There are currently 97 people in hospital in Alberta, including 13 in intensive care. We have seen an increase in acute care admissions in recent weeks, primarily linked to the outbreaks at the Foothills Medical Centre and Misericordia Hospital. 41% of our current COVID hospitalizations are due to acute care outbreaks. We are watching our province's health system carefully to ensure that hospitalizations and ICU admissions remain within our province's capacity. We identified on average 240 cases of COVID-19 a day over the long weekend. Breaking it down by day, on Friday, 236 new cases were identified, while our lab conducted more than 16,000 tests. On Saturday, we completed more than 13,800 tests. We also identified 259 new cases. On Sunday, we diagnosed 246 cases and almost 16,700 tests. And yesterday, the lab conducted more than 11,000 tests and identified 220 new cases. As I noted last week, due to the long incubation period of COVID-19, it will be at least a week or two before we start to see the impact of the voluntary measures announced last week for Edmonton Zone. I continue to be concerned by the rise in cases. The Edmonton Zone remains the hotspot in the province with 1,444 active cases right now. Sadly, I must report that there have been 4 deaths from COVID since my last update on Thursday. Turning to schools, as of today, AHS has confirmed that 70 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 209 schools. That is about 9% of all the schools in the province. Currently, these schools have 464 active cases in total. This number includes 88 schools that are on outbreaks, including 21 currently on the watch list. So far, in-school transmission has likely occurred in 53 schools. Of these, 33 have had only 1 new case occur as a result. While we have seen a rise in cases being identified within children between the ages of 5 and 19, this mirrors a similar rise that we are seeing in the community and comes as we have also seen significant increases in testing in this age group. Testing rates in this age group of 5 to 19 are more than double other age groups, and we continue to see a less than 1% positivity rate in school-aged children. As I've said before, one of the best ways to limit cases in schools, hospitals, and continuing care is to limit transmission within the community. Starting tomorrow, we will be shifting to an appointment-only approach to testing at AHS assessment centres. This means that Albertans will now be required to book an appointment to get tested at these assessment centres. For most people, this will have no impact on your testing experience. Drop-in testing is only a small part of the testing currently being done. In fact, about 93% of the tests are already being booked by appointment, online, or by calling HealthLink. By shifting to a province-wide by-appointment process, we will make on-site testing quicker and more efficient. We will also reduce crowding in lines and help ensure that everyone is tested as quickly and safely as possible. Anyone can book an appointment online. If you don't have access to a computer, you can also complete the assessment and booking process by calling HealthLink at 811 and speaking with a registered nurse. I also want to ask those who book appointments to be sure to keep them or cancel online if you are no longer able to attend. The assessment centres are seeing a high no-show rate lately, which causes further delays in making appointments available for those who need them. For example, Calgary saw a 14% no-show rate this weekend. It is easy and convenient to change or cancel your testing appointment online, freeing up your spot for someone else. Please help us make the system as effective and efficient as possible. We are committed to reducing the time it takes to get tested and receive your results. We are looking hard at ways to make this happen. Cold and flu season has begun, and as I've said before, we are seeing a rising number of people with COVID-like symptoms that increases our demand for testing. At the same time, we are conducting more tests than ever, averaging more than 16,000 per day. We are actively exploring ways to make our testing approach faster and more strategic, and I hope to have more updates to share in the coming weeks.